Also want to talk about sleep apnea. We'll come back to those tips and tricks for getting a good night's sleep. Sleep apnea, though, is another very common sleep disorder. What most people don't know is that there's two types of sleep apnea. All right? We have the obstructive sleep apnea, which is the one that we're most commonly hearing about. When somebody says they have sleep apnea, it's this obstructive sleep apnea. That's where something's blocking their airway, okay, and that's causing them to have these continuous pauses in their breathing throughout the night that they have to then rattle themselves awake for to breathe. Okay? But there's also central sleep apnea, and central sleep apnea is a neurological condition. So your brain isn't sending the right signals down to your throat and your lungs to keep breathing as you sleep. Okay? So they're treated by different individuals. The obstructive sleep apnea, you're going to see a pulmonologist or a sleep medicine doctor for that. Central sleep apnea, you're going to see a neurologist for that sort of treatment. Okay? At the core of both of those, though, the apnea piece is where there are those repeated and continuous interruptions in breathing during the night. Okay? Sleep apnea can be a very dangerous condition if not properly treated and managed. All right? We know just from the brief research that's out there that those that have untreated sleep apnea are at higher risk for chronic illnesses, for injury, and for earlier death. Okay? So it's something that we want to have treated.